Although the rates of childhood obesity have increased nationwide over the past few decades, the problem is more significant in some states than others. Data from 2007 shows Mississippi with the highest number of kids considered overweight or obese. Oregon had the lowest. Children in Illinois, Tennessee, Kentucky, West Virginia, Georgia, and Kansas were also more likely to be obese. And on the heels of that, obesity is the biggest health problem facing Americans today, costing $147 billion a year. The Centers for Disease Control says childhood obesity has tripled over the past 30 years, putting kids at greater risk for the illnesses like diabetes. First Lady Michelle Obama certainly made tackling childhood obesity her main objective, and this week she scored a major victory. The nation's leading food companies have agreed to cut 1.5 trillion calories from their foods by 2015. David Edinburgh has been on the front lines of fighting childhood obesity for more than 40 years as the founder and co-owner of Camp Shane. And Dr. JOANNA DOLGOFF specializes in treating overweight children, and she as well oversees Camp Shane's nutrition program. And good morning to the both of you.
Good morning.
You heard in that health watch before we came in about geographical propensity towards obese, overweight kids. Mm-hmm. Do you see that, doctor, as being true? Are there certain areas of the country that are more prone to it?
Well, there are certain areas that are more prone to childhood obesity, but the truth is that children all over the country, all over the world are obese. So while there might be some increased areas, it's something that affects our children across the board.
And does it all begin with food, or is there a role that genetics plays as well?
Genetics plays some role, but the truth is the obesity rate is skyrocketing and the gene pool is stable, so genes can't be entirely to blame.
Okay. We talk about how this has really skyrocketed the last 30 years or so, and yet this Camp Shane, that's been around, David, for 40 years.
Right.
What got you going here, and how effective do you think you've been?
Well, I think it's always been a problem, and even going back 40 years ago, there were kids with fighting weight. But I think there's a much greater awareness now, and of course there are more kids that are overweight. So
tell me what a day at Camp Shane's like.
Well, Camp Shane is really designed to be a place for kids to be successful. A lot of kids have difficulty trying to do this at home. So if you take them out of home and put them in a place where their eating is controlled, mm-hmm. and they have lots of physical activity, I think together they work for the kids to have very successful weight losses.
And doctor, do you see if kids get a jump start, if that's what Camp Shane's role is? You get them going, but they can't stay there 24/7, so they get home, but they see themselves looking a little better, feeling a little better. How successful is it then long term?
It is successful long term, particularly with the situation that we have. Camp Shane and I have teamed up. My program is Red Light, Green Light, Eat Right. We've teamed up together so that we can keep these kids healthy all year long. So it's not just 2 months of the year.
Red Light, Green Light, Eat Right means what? Don't eat, go ahead and eat, and you know.
Right, so I've taken every food and divided them into 3 categories. Green light foods are healthy, yellow light foods are moderately healthy, and red light foods are least healthy. Mm-hmm. And Camp Shane has made it a big initiative of theirs to make sure that their campers stay healthy mm-hmm. all year round by bringing my program in. So together, we're treating the kids all year long.
All right, and David, real quick, for those kids who can't get themselves to a Camp Shane, one piece of advice for them to get jump-started on eating more healthily.
I think that they need to learn about nutrition. I think they can go to Camp Shane's blog. We have newsletters they can sign up for on campshane.com for free. It's very helpful.
Okay. Well, David Edinburgh and Dr. JOANNA DOLGOFF, thank you so much, the both of you.
Thank you.